You have a unique setup there in your office. So you have Neuro Wellness MD, which is your medical office. And then in the same location, you have Prolo Healing Men's Spa. So I think that's a really interesting combination. And it tells me that you don't limit your treatments to just what's covered by insurance. Like, how would you manage that across each of your enterprises?
The very first thing I would do is to look into what could be the etiology or what's the cause of the issue. So for some of these folks, we may do some laboratory testing, maybe do some imaging too as well, depending on what it is that it may be. After we've done the basic medical workup, then we might dive in a little bit deeper with some other additional diagnostic tests. But for those people also, for instance, when you kind of talked about ED, there are people who have already seen the urologist already, and they're looking for different alternatives. And so we've gotten that question asked a lot from a lot of folks who come in, and they're asked, is it a neurological issue or whatnot? And sometimes, even though it very well may be in some cases, we want to be able to offer things that are different out of the norm so that they can actually get a result for what they're looking for, not necessarily just taking a medication or a pill that may cause potential issues, which could be quite serious if they did take them. It's the same thing as you mentioned for hair. We would certainly, do some diagnostic evaluations, some lab testing to make sure everything looks okay. And there's not a medical reason why they're losing their hair. At least that's very discernible, such as maybe having low iron or having a thyroid problem, which are two very common things, for instance. For those people then who have already gone ahead and tried different topical treatments or medications, then we offer in other things such as PRP treatments to try to help stimulate that hair growth. A lot of times I've had plenty of patients ask me about these kinds of things, which aren't traditional neurology, but the amount of people that have asked me over the years consistently kind of amazes me. And so it tells me that their issues and their needs aren't really being met. And so that's why I've looked into other things to be able to help them.